All right, good morning, everyone. My name is Abby Tynan. I use she, her pronouns, and I'm the communications coordinator for CSU Health Network. And I want to thank you so much for joining us today for our International Student Orientation presentation. And so before I start the presentation from the CSU Health Network, I'm going to be dropping some helpful links into the chat for you. So this is information from our website, our new student checklist, information on international student health insurance. And so these are great links that you can reference at any point during the presentation or at any point after the presentation or throughout the fall semester. So let me drop those in and then we will get started. Okay, I think folks should be able to see that. So we will get going. Okay, thank you.
And Abby, I just thought we might want to remind people or let people know about how they can ask questions.
Yes, definitely. Yep, I have that upcoming. So perfect. As Bronwyn has prompted, please feel free to use the Q&A. We'll be monitoring that throughout the presentation. So again, drop your questions in the Q&A and we'll make sure that we can get to those as soon as possible. So again, good morning and welcome. My name is Abby Tynan. I use she, her pronouns, and I'm with the CSU Health Network. And we are every student's on-campus home for health and well-being at CSU. And so today I'm going to be going over the services provided for you at CSU Health Network, and I'm also going to be reviewing the new student requirements and recommendations. And so as I mentioned a couple minutes ago, please feel free to use the Q&A to chat any questions, and then we will make sure to get to those. And then just a reminder, all of our information covered in this presentation today is on our website, health.colostate.edu, and that link is in the chat. And then that's just a great resource for you if you have any questions throughout the remainder of the summer or the semester. And then on this call, we do have Lynn Bunn, who is from our Student Health Insurance Department, and Bev Early, who's from our Immunizations Department. They will be in the background kind of answering questions that you have. So again, use that Q&A function. And then at the end of the presentation, we're happy to address some questions on a larger scale as well. So let's kind of dive in here. So first, just a little bit about the CSU Health Network. So if there's one thing that you can take away with you from this presentation, it's that all enrolled students have full access to all of our services, regardless of your insurance plan. And so we truly are here to support you. We are every student's on-campus home for healthcare at CSU. And we like to pride ourselves on integrated care for the whole student. So we don't like to look at students as kind of pieces and parts of themselves, but as one larger unit, because we know physical health and mental health are so greatly intertwined. And unlike other colleges and universities across the country, we do have integrated medical and counseling services all under one roof. We have over 200 providers and staff members that are experienced with and passionate about college health. And we are also accredited by the AAAHC, as well as the American Psychological Association. And every summer, we always get the question, do you have real doctors, or are these students practicing on students? And the answer is yes, we have real doctors. They are board certified providers that go through rigorous accreditation processes, and they are very passionate about working with the college student population. So this presentation is going to cover these four main service areas. We have our medical, our counseling, our health education and prevention services, as well as our business services. So some of you may be asking, what is the CSU Health Network? So the CSU Health Network provides medical, counseling, and health education and prevention services for all students. So we truly are that first stop for medical and counseling health needs at CSU. And in addition, this probably differs in the US as it does potentially where you are from. So we are private and confidential. So no one is going to know what you come to access at the CSU Health Network unless you want them to. So your visits with your providers are completely private and completely confidential. So let's dive into those medical services now. So our medical services are broken up into kind of two areas. So we have our general services and our specialty medical services. So within our general services, we have our primary care. So you can kind of think of this as your regular doctor. If you need a checkup, you can come and receive that at our facility. We also have a pharmacy right on our first floor. So maybe you are taking a prescription medication, or say you get prescribed something at some point during your time at CSU. you can pick up that prescription directly from our pharmacy on the first floor. And then we also have a variety of over-the-counter medications as well. In addition, we have an immunizations department on our second floor. So say it's flu season and it's time for your flu shot, you can come and receive that at our facility in addition to a variety of other vaccines. And we will be talking a little bit more about the COVID-19 vaccine in a couple of slides, so I'll touch on that shortly. Also, as part of our general medical services, we have our laboratory, radiology, and then behavioral health. And then our specialty medical services really set us apart. So we have a ton of services that folks may not think that we would have in a college healthcare facility. So for example, we have our allergy and asthma clinic. And so say you are receiving allergy injections, you may receive those at our facility. We also have a dentist, so you can get your teeth cleaned right at CSU. We have optometry. So not only can you receive your annual eye exam, you may also pick up your contacts directly from us. We have physical therapy, psychiatry, transgender care, travel medicine, women's care. So just a variety of specialty medical services that really set us apart from other offerings from other colleges and universities. So if you're interested in accessing our medical services at any point during your time at CSU, we strongly encourage you to make an appointment either online or by calling. And while students are definitely best served by making appointments, if you have something that needs immediate medical attention, maybe you're injured, vomiting, whatever the situation may be, you can walk into our facility. However, with COVID-19 and kind of this evolving and changing landscape, we do encourage you to just check on our website or call just to make sure that our services are still being offered in person. And right now they are, and we expect that to be the case throughout the fall semester, but it's just kind of a good practice just to check, because we would hate for you to come in and then not be able to see walk-ins. So just make sure to check on our website. Every time that you need to access our medical services, you need to bring your CSU ID. So that's just your RAM card and then your insurance card. And so then your out-of-pocket costs are dependent on your health insurance plan benefits. And international students are automatically enrolled in SHIP. And so there's more information on the CSU Student Health Insurance Plan in the chat. And you can read more about that there, and it kind of goes into the details of exactly what is included in the CSU sponsored student health insurance plan. Next, we have our counseling services. And so we're very proud of the culture of help seeking that has been embraced by CSU. And this is all the way from the president's office to faculty, staff, and students. And we know that mental health was a priority prior to the pandemic, but now with folks feeling isolation and loneliness, we know that mental health is going to continue to be an even larger priority as we kind of navigate this new landscape. And so by paying student fees, all students get access to a wide range of mental health support resources. And this includes skill building workshops, group therapy, and individuals and couple sessions, plus many other resources. And so we really like to tell students it's never too early and it's never too late to get the help that you need. So if you are interested in accessing our counseling services, you can come into our counseling office, which is located on the third floor of the CSU Health and Medical Center. And our licensed professionals will work closely with you to determine the services that are right for you, given your goals, your preferences, and then of course, what's clinically appropriate. So then this next slide here goes just a little more in depth on exactly what to expect when accessing counseling services at the CSU Health Network. So the first step is to come and see us. So we have folks that are working during what we like to call our drop-in hours. And so you will talk through with our counselors where your areas of concern are, your goals, your history, your unique circumstances, and your identities to put together this wellness plan or kind of next steps that best fit your needs and preferences. So for some students, this may be individual counseling. Others, this may be groups and workshops, maybe online resources, or even some resources across campus. And then this next slide just kind of briefly covers our final two service areas. So we have our health education and prevention services, otherwise known as HEPS, and then our business services. And within HEPS, we're very proud of the robust skill building programs and services that are offered. So we have services all the way around substance abuse prevention, mental health initiatives all the way along the spectrum from stress reduction to suicide prevention. We also have our peer education group crews, and they do a lot of wonderful work around choice making, bystander behavior, what it means to look out for your fellow RAM, and how to spot a student in distress. And if you've heard the tagline at all, or maybe you will hear this at some point during your time at CSU, Rams take care, Rams take action, that actually comes directly from our peer education crews. And then rounding out our health education and prevention services department, we also have well-being initiatives, sexual health initiatives, and tobacco cessation. And then you can think of our business services as just kind of that internal branch of the health network. And so our business services folks work with our student health insurance, our private insurance billing, our RAM Care supplement program, and our medical records. So if you have been to Fort Collins, you may have seen this building on the corner of College and Prospect. So this is the CSU Health and Medical Center, and the CSU Health Network is housed within the CSU Health and Medical Center. And we take up the entirety of the second and third floor and about half to 3/4 of the first floor. And so directing your attention over here to the map, for folks who maybe have visited Fort Collins before, especially in a non-pandemic year, you may have noticed that parking is definitely a hot commodity at CSU. And so when we were building the CSU Health and Medical Center a handful of years ago, we didn't want availability of parking or cost of parking to be a barrier to students accessing our services. And so I believe we have one of the only free lots on campus. So as long as you have an appointment at the CSU Health Network, you can park in our lot for free. Then I also want to direct your attention to the Around the Horn stop. So Around the Horn is a campus bus that has stops throughout campus, and it also has a stop kind of outside of the CSU Health Network. And so depending upon where you are on campus or maybe where you're living on campus, Around the Horn could be a great option for you to reach our services if you are not interested in walking or biking or longboarding or whatever your transportation may be. And then in addition, we have our MAX stop. So MAX is a Fort Collins bus that runs parallel to College Avenue, which is one of our main roads in Fort Collins. And so CSU students can ride the MAX for free with their CSU ID. And so again, depending upon where you're at in the community or on campus, the MAX stop could be a great way to reach our facility, as we have a stop about a couple hundred feet from our west entrance. So now you may be asking yourself, why does the CSU Health Network exist? So we truly exist to serve students, and we want to help you with your medical and mental health needs so you can succeed during your time at CSU. So we know that physical and mental health are they play a critically important role on your path to graduation. And so we truly believe that we have the services to kind of set you up for success during your time here at CSU. So we truly exist to help you get healthy, stay healthy, adjust to a new environment, and solve problems that may arise during your time at CSU. So then this next slide here talks about when. So when we are open, and then exactly how you can reach us. So the CSU Health Network is open Monday through Friday, about 8 a.m. to 5 p.m. And we do have adjusted hours during CSU breaks. And then while our counseling services has a few evening options, for the most part, we're still open Monday through Friday, 8 to 5. And if you're curious about our current hours of operation, you can go to our website, health.colostate.edu, and read more there. And so we do offer phone helplines that students can utilize at night and on the weekends for urgent problems. And then one thing we do like to tell students is, please don't wait. Come early, just when your problems are starting. So we don't like things to kind of build and grow. Come and see us if you have issues, whether it may be a physical or a mental health problem that is arising. So we kind of touched on this a little bit during the discussion about our medical services, but just to reiterate exactly how to access us. So of course, we encourage students to make appointments. So this is our phone number on screen. Feel free to jot that down, take a screenshot, whatever works best for you. So definitely students are best served by calling to make an appointment. However, we do offer walk-ins, and again, I encourage folks to check our website just to make sure what services are being offered in person, and right now it's all of them. But again, this COVID-19 landscape can be tricky, and we don't know what potentially may change during the fall semester. And then in addition, you may schedule appointments online for our medical services. So that's definitely an option for medical, but you do need to call if you are interested in accessing our counseling services. So as I had mentioned, the CSU Health Network is only open about Monday through Friday, 8 to 5. And so if you are sick, of course, the first option, we encourage you to come and see us. We are on campus and we have all of those medical and counseling services that I had mentioned that you can access. However, if we are closed, I do encourage you to utilize our phone helpline. So we have our 24/7 nurse helpline, as well as our mental health crisis intervention line. And so if you're not feeling well, you can call our nurse helpline and talk with one of our on-call nurses about your symptoms and kind of what you're experiencing. And that nurse can guide you whether it's appropriate, say, to maybe wait for the morning when the CSU Health Network is open, or maybe they'll encourage you to access some local urgent care facilities in the area. And there is a list of those on our website, health.colostate.edu. And then there's also some information here on emergency care. So in the United States, in the event of a life-threatening emergency, you call 911. And so that will take you to our emergency care line here in the US. And then we do have a variety of emergency rooms. So we have our Poudre Valley Hospital emergency room. That's probably the closest to campus. And so there's information there. And then we also have Banner Fort Collins Medical Center, and there's information on Banner also on the screen. However, emergency room care in the United States is definitely costly and can be expensive. And so we'll kind of go over a video of an overview of the US healthcare system in a couple slides, just so you are aware of exactly what that looks like here in the United States. So then how will you pay for these medical services that you may be accessing during your time here at CSU? So your health insurance will help pay for medical services at CSU. And so for most folks who are international students, that's probably the CSU sponsored student health insurance plan. And what you owe will depend on your health insurance plan benefits, and that is for medical services. However, your counseling fee, which is part of your CSU student fees, will provide you access to all of our mental health support services at no additional cost to you. So we will bill your health insurance for medical services, but our counseling services are covered under student fees. So now we're going to take a quick quiz just to make sure you've kind of been paying attention. I know it's kind of still a little early on a Monday, so I'm going to ask you all to use the chat function. So I'll quiz you and then just kind of drop your answer into the chat. I'm sure we're going to have a ping of chats, and that's fine. So we'll kind of see how this goes here. So question number 1, what services are provided at the CSU Health Network? Is it A, medical services, B, counseling services, C, health education and prevention services, D, all of the above, or E, what? I just woke up. So go ahead and just throw some of those in the chat. I'm seeing some of those. Yep, looks like everyone is spot on here. So the answer is D, all of the above. So CSU Health Network is every student's on-campus home for medical and mental health needs at CSU. So now let's go to the next question here. Do you have to be really upset to see a counselor? A, yes. B, no. C, they said no, but I think you do. Okay, we got some things popping into the chat here. It's like everyone's paying attention. It is B. The answer is no. You do not have to be really upset to see a counselor. Our counselors are truly here to help you with your problems, whether they are big or small. All right, question 3. What are reasons to come and access medical services at CSU Health Network? A, a bad sore throat. B, headaches. C, sickness. D, questions about women's health. And E, all of the above. Things are already pinging in here in the chat. Awesome. So the answer is E, all of the above. So whether you're not feeling well, if you have health questions, please come and see our medical services staff on the 2nd floor of the CSU Health and Medical Center. All right, 2 more questions here. Should you go to the hospital if you have a life-threatening illness? A, yes. B, no. Okay, we've got a variety of answers coming in here. Awesome. Looks like they are mostly A's, and that is the correct answer. So the answer to question number 4 is A, yes. If you have a life-threatening illness or emergency, you should go to the hospital or call 911. And so final question here, who will we tell about your visits? If you come and access services at CSU Health Network, who will we tell? A, parents, B, teachers, C, friends, or D, none of the above? Awesome, I'm seeing a lot of D's in the chat. That's great. So the answer is D, none of the above. The CSU Health Network is completely confidential, and we will not tell anyone about your visit unless you want us to. So thank you so much for kind of playing along with our quick pop quiz. I'm going to close the chat on my end, and we will keep going with this presentation. So this next portion of the presentation is now regarding our new student checklist. So these are all those requirements and recommendations for new students at CSU. And again, you can find all this information using the links in the chat or on our website. And again, these important websites are health.colostate.edu. And then some of the information I will be covering is on RamWeb, which is ramweb.colostate.edu. So the first thing I'm going to touch on here is submitting immunization records. So Colorado law does require every student to submit 2 measles, mumps, and rubella vaccinations. So you have to submit proof of 2 MMRs. And then for students who are living in student housing, Colorado law does require students to submit proof of the meningococcal vaccination given within the last 5 years. So that's kind of the key there. And then students have probably heard now about the upcoming COVID-19 vaccination requirement. And so while we're still kind of waiting for that policy to kind of be put in place, CSU students can voluntarily submit their COVID-19 vaccine records to the CSU Health Network. And information on the specifics around exemptions will be available when the official CSU policy is in place. And this is pending full approval of 1 or more of the vaccines by the US Food and Drug Administration. And if you do not have access to a COVID-19 vaccine over the summer, there will be on-campus vaccine clinics in August. So if you have yet to receive your COVID-19 vaccine, you will be able to do so on campus in August during, I believe, move-in week. So definitely that's kind of a great benefit. So make sure to kind of jot that down. At the end of the presentation, I'll actually put some information about that into the chat for folks. And in addition, we also know that there are pressing questions about this upcoming vaccine mandate, maybe masks and screenings, and returning to class in person. And so the CSU pandemic preparedness team is truly focused on this fall planning right now. And so they continue to work closely with Larimer County Health and to just really understand and assess all of this changing information and how to best apply that to CSU. And so our university leadership, the Board of Governors, and our public health experts are kind of in discussion about these next steps. And we actually anticipate that we'll be able to answer many of your questions at some point this week, if not today. So definitely stay tuned for some information from the pandemic preparedness team. So students can submit all of your official immunization records online through the CSU Student Health Portal. So we do not accept any paper submissions. So all of them happen online through the Student Health Portal. You can scan your records or take a picture of them and then submit them online. And then there are detailed instructions in your booklet and on our website. And your immunization records do need to be in English. So I do want to mention that. The due date again for your immunization records is the first day of class, Monday, August 23rd. And so if we do not receive your immunization records by the first day of class, there will be a hold placed on your student account. And then you will not be able to register for classes for spring semester until you have submitted those immunization records. So definitely make sure that you get those in so that you are compliant by the first day of classes. Then this next bit of information here is about completing health forms. So these are not required, but definitely highly recommended. And so this is the tuberculosis assessment and the health history form. And these are online forms that can be completed on the CSU Student Health Portal. And so you can complete the tuberculosis assessment by just filling out this quick questionnaire on the CSU Student Health Portal. And then your health history just provides us kind of a complete background of your health prior to you arriving at the university. And so this next one here, I'm going to just briefly walk you through how to access the CSU Student Health Portal. So this is a screenshot of our website, health.colostate.edu. And you can see here on the quick panel links that there is a Student Health Portal link. So if you click that, it will bring you to this page, which is portal.health.colostate.edu. And you can log in with your e-name and password. And then once you log in there, it will take you to this page. And so you will always have, generally this is kind of a good gauge. If you have this, you have pending forms notification, that's generally a great way to kind of tell if you have or have not met these requirements. However, you can always access your My Forms through the My Forms button. And then when you're ready to upload your documents, such as your immunization records and maybe your COVID-19 vaccine form, you can upload those directly through the document upload button on screen. So now I want to share a video with you, a quick overview of the US healthcare system. So I'm going to stop this screen share and start another screen share, and then we'll kind of resume. So just a second here. Okay, I think folks should be able to see that. Let me make this bigger.
The U.S. healthcare system offers some of the best medical care in the world, but it is complex, difficult to navigate, and often very expensive. The U.S. system will also likely be very different from the healthcare system you are used to back home. In this section of the video, we offer a few simple tips.
Abby, we lost sound. So I am aware that we lost sound. We're going to try to get back to that in just a second. Oh, there we go.
By now, it's clear why you
So Abby, we lost sound after the first
insurance.
part of it. You may want to restart the video.
Some portion of the cost of your medical care.
Oh no, this is remote presenting. Okay, let me start over here. And will you just kind of give me a thumbs up?
I think when you muted yourself, we lost sound.
Yeah,
Oh.
exactly.
Oh my gosh, well, that's my fault. I apologize. Thank you, everyone. I'm sorry. Okay, I didn't want you to hear me, so. Okay, here we go. Ready?
The U.S. healthcare system offers some of the best medical care in the world, but it is complex, difficult to navigate, and often very expensive. The U.S. system will also likely be very different from the healthcare system you are used to back home. In this section of the video, we offer a few simple tips. First, like most Americans, you will need a private insurance plan, either through your school or one that you purchase directly. There is no universal access or national health care like many countries offer. When you seek any medical care, the provider you choose, hospital, doctor, or clinic, will look to you and to your insurance carrier to get paid for their services. There will be no payment from the government, and healthcare can be very expensive in the US. Here are a few recent real-life examples. Appendicitis, $60,493. Fractured humerus, $47,445. Fractured clavicle, $18,393. Car crash or serious illness, $150,000 plus. We hope by now it's clear why you need insurance. However, even with insurance, you should still be prepared to pay some portion of the cost of your medical care. Cost sharing is an important element of the US system. So medical care is never entirely free, and each time you access the system, you should expect some cost. While your insurance plan will typically cover the majority of expenses, there will be copays, deductibles, co-insurance, excluded charges, or some combination of these items that will ensure that you pay something. Carefully review your insurance documentation so you understand how these payments work for your plan.
Okay, so it's definitely a little bit of a dramatization of a video, but what you can see is that the US healthcare system definitely differs potentially from the healthcare that you have in your home country. So I'm gonna stop sharing of the video and go back to the presentation here. Okay, so now we're moving on to the health insurance requirement. So this is definitely another one of those major kind of to-do lists on the requirements for new students. And so by fulfilling the health insurance requirement, this is required for all international students, and all international students are automatically enrolled in the CSU Student Health Insurance Plan. And so you are billed for the cost of the plan after you register for classes. And then if you do have private insurance, maybe from your home country or you're sponsored or whatever the situation may be, you can opt out through our waiver process as long as you can show proof of acceptable private insurance coverage. And so Lynn, who is on the call here too, you're more than welcome to chat in the Q&A. If you have questions to her, she can answer specifics about the health insurance requirement for incoming international students. So if you do have other insurance coverage, you can submit a waiver request. So there's a waiver request form and a copy of your current insurance policy to the CSU Health Network Insurance Office. And so the deadline to do this is Wednesday, September 8th. So this is the deadline for the health insurance requirement. And so accepted waivers include most employer group health plans, approved sponsor plans, as well as individual plans that meet healthcare reform law. But then there are some waivers that will not be accepted. And so those include short-term plans, such as international student plans, foreign plans, and then individual plans that do not meet healthcare reform law. And so a little specifics on the CSU Student Health Insurance Plan. So SHIP will pay all costs for most medical services within CSU Health Network. It pays 60 to 80% of most medical costs at a hospital or medical clinic. So this is care that is received outside of CSU Health Network. And this is after you pay your deductible. And then you also will receive $250 worth of flex dollars. And you can use these towards non-covered services at the CSU Health Network. However, SHIP does not pay for dental care, vision care, elective services, non-medically necessary services, massage therapy, or over-the-counter medications. So again, we're happy to answer any questions about SHIP here shortly at the end of this presentation. So now we're going to be moving on to completing online modules. So alcohol, EDU, and sexual assault prevention are required for all incoming first-year students. And sexual assault prevention is required for every CSU student, regardless of what age you are when you enter the university. And so alcohol EDU provides personalized feedback that encourages students to consider their own drinking decisions and those of their peers. And then sexual assault prevention educates students on issues associated with stalking, interpersonal violence, and sexual assault. And so you should have already been receiving emails alerting you that these programs are open for student access. And so you can log into your RamWeb account and complete these modules. And then the due date to complete these is the first day of class, so Monday, August 23rd. And if you do not complete these required modules by the first day of classes, you will have a hold put on your student account and you will not be able to register for classes for spring semester until these modules have been completed. So please go and check your email for your CSU email account, log on to RamWeb, and just make note to complete these required online modules by the first day of classes. And so the next one here is creating a U at CSU profile. So U at CSU is your online student success portal. And so it's going to connect you to personalized on-campus and online resources. And so U at CSU provides confidential, customized feedback to help you meet your goals or address your concerns in 3 areas: succeed, thrive, and matter. And so we definitely encourage you to set up your profile now, and you can access U at CSU through RamWeb and just start exploring all the great resources that CSU offers students. And I want to wrap up this kind of formalized presentation by just telling you we truly are here for you. We know that this adjustment to college can be difficult for some folks, and especially navigating this in kind of this COVID-19 landscape. And so whether you need medical care or mental health care, we're truly here to support you. And so at this point, I'm going to stop sharing and I'm going to be addressing some questions in the Q&A. And then I'm also going to invite Lynn and Bev, if you're still on the call, to maybe answer some of these questions as well, if you are willing.
Yeah, this is Bev, and a lot of them had a similar theme. So I just thought I would answer all those at once when we get to that section about MMR vaccines and some of the options that are available.
Yeah, if you even want to preemptively answer them, that's great. If you already kind of
Sure, yeah.
I have yet to go through the Q&A, so I'm going to kind of dive into that right now.
Yeah, so the MMR vaccine is required. 2 doses are required, given on or after your first birthday and given at least a month apart. And if you don't have documentation of those vaccines, you have a couple of choices. You can get the vaccine here at the CSU Health Network. And what you need to do is just call the 970-491 7121 number to make an appointment. So immunizations is an area where we do not take walk-ins. It's by appointments only. So you will have to call that number to make an appointment for any of the immunizations. You can also have a blood test done, which shows you have immunity, and it's called a titer. And that blood test can be done here as well. The only thing you need to look at is your insurance coverage for that. Typically, most of the vaccines are covered by your insurance, but with the CSU insurance, they are typically a covered benefit. But if you have other insurance, you'll just need to check with that provider to make sure it's covered. And then lastly, there is an exemption form you can sign, but we don't encourage that because if there would be an outbreak on campus, you could potentially be quarantined from campus or not allowed to come on campus for your safety, since we wouldn't know your immunity status. So I think those answer a lot of questions about the required vaccinations. You can get most vaccinations here at the CSU Health Network. We carry all the adult vaccines, and you just need to call to make an appointment to get those done here. So hopefully that answers some of the questions, and then we can go and see if there's other questions that need to be answered. And I know, Abby, you're going to address some of the questions about the COVID vaccine. And with the COVID vaccine, it depends on what COVID vaccine you got in your country as to whether you will need to start the series over here in the United States or not. If you got in a vaccine that is accepted by the World Health Organization, then that vaccine is fine here and we'll accept it in the United States. If you started one of the vaccines that are accepted, such as the Pfizer, Moderna, or in another country, you can complete that series here. If it was a different vaccine, then you might have to start this series over with one of the approved vaccines that we have in the United States. So hopefully that answers some of the questions that you have about those. And if there's more that come up, just let me know.
Thank you, Bev. And I'm just going to kind of go through these and you can tell me, I believe you answered some of these, and if I missed that, I apologize. So one of the questions is that we have a student who has not currently taken the COVID-19 vaccine and maybe does not have some of their other immunizations either. And so you can receive your required immunizations at the CSU Health Network. And again, as Bev said, we're not taking walk-ins, so definitely make an appointment. And then you can also receive the COVID-19 vaccine during move-in. And so I will be dropping information in the chat on that as well. So just know that if you have not received your vaccines, you can receive them when you arrive at CSU. That's correct, right, Bev?
Mm-hmm, correct.
Yeah, okay, great. So I'm just kind of going through these here. We talked about being able to take the titer, is that correct?
Correct.
Okay, yep. So just know if you do not have proof, you can get proof of those vaccines when you arrive at the university. So we've answered that question.
I think there was some on tuberculosis testing as well. And
Sure.
so we do 2 types of tests here. We do one that's a skin test, but if you're from a country where you got the BCG vaccine, we do a blood test that's called a T-spot blood test. And that's what you could get done here at the CSU Health Network as well. You just have to remember that testing has to be done before probably about 1:30 in the afternoon. So you would want to schedule that before that time as well to get that testing done.
Great, thank you, Bev. I appreciate that. Okay, interesting. So this one says, I already uploaded my immunization records. However, I found that there's an error in my immunization history. Can I fix this issue? And yes, you should be able to re-upload your immunization records, I believe. Bev, can you confirm that as well, please?
Yes, you can. You can re-upload your records. You just do it through the CSU Health Network portal. And then if you ever have any questions, just give us a call at the 970-491-7121 and they'll direct the call to us and we can look up your record and kind of verify what the changes are and if you changed it correctly.
Thank you. Okay. Do you provide HPV, varicella, and meningococcal vaccines? Yes, we do.
Yes, we do. Yeah.
Excellent. So the question here is regarding the due date of the COVID-19 vaccine. And so there's going to be more information coming about the policy surrounding COVID-19 vaccination. So I would say you're going to be hearing from CSU shortly. And again, the official policy at the moment does not go into effect until full approval of one or more of the vaccines by the FDA. So right now we are just taking voluntary COVID submissions. So there is not a hard due date for the COVID-19 vaccine at the moment, but we are strongly encouraging you, if you've already received your vaccine or are planning on receiving your vaccine, please do so by the first day of classes and then voluntarily submit those records if you are willing. Okay. Okay. So again, we've talked about being able to prove that you've received vaccines. We've done that. If you've already submitted health forms or immunization forms from a previous semester, for some reason, you do not need to submit those again because we already have those on file. So let's see here. Okay. This next, Bev, I think I might have you try and chime in on answering this question. So I'm not exactly sure. So the question says, I received my first COVID shot a month ago, but my next shot is in 3 months, and by that time I'll already be at CSU. Can I receive my second shot at CSU Health Network? I would say for that one, it also probably depends on what type of vaccine you receive, but Bev, I'll kind of maybe let you talk through that.
Yeah, that's exactly right. So it just depends on what the dose was of your first vaccine. Number one, if it was a WHO accepted vaccine. And so we would just have to individually evaluate that to determine what you need to do for your next steps.
Great. Okay, I'm just trying to get through all the immunizations questions real quick before we go on to insurance here. So, Bev, maybe you can answer this one as well. So this person says that they will be staying in university apartments with their wife. And so would she need to be able to provide meningococcal vaccine information?
No, it's not required if they're living in the apartment setting. It's only required in the residence hall when they have more of that congregated setting.
Great, thank you. And so we already talked about blood tests. Okay, so this person says, what do you do if you don't have any immunization records? Again, I would encourage you to make an appointment at our immunizations department, and then you can also receive those required immunizations directly through our facility. We do, oh, that's a different question. Okay. This person says, regarding their MMR vaccination, since there's a month difference between their first shot and their second shot, how will I be able to submit proof before the first day of classes? So for that one, we just encourage you, as soon as you have your MMR doses completed, just submit that. And then as soon as those are submitted, you will have that hold removed from your student account. And again, you can't register for, about halfway through the semester, I believe. So that should not be an issue for you. Is that correct, Bev?
Correct. So as long as we call it in process, if you want to go ahead and submit your first record, we'll take that and put it in your record. So that way we can see that you're in process and that you can't get your second one yet until that 28-day time period is up.
Great, thank you. And this person says, if I upload only my first dose of my COVID vaccine and then and I upload my record for that, do I need to upload information to the second dose? And we would say yes.
Yes.
Provide proof of both doses.
Correct.
If you'd like to submit proof of the first one, I would say go ahead and do that. And then when you get the second dose, resubmit. Bev, is that how you'd like them to do that?
Correct. Yes.
Okay. Excellent. Okay. But maybe you can speak to this one. So this person says, and this is also probably a little nuanced, are Chinese vaccines recognized in the United States? It sounds like maybe it depends on what the exact vaccine you are referring to.
Correct. Yeah, we'd have to see the name of the vaccine to see if it was accepted or not.
Great. Okay. Oh, sorry, there keeps being more chats coming in. Okay. For those of you who are wondering where you can upload your immunization record, you can upload the immunization records directly to the CSU student health portal. And there is a link in that on our website. And I can also drop that in the chat as well. Okay. Bev, guide me here. If my COVID-19 vaccine is not approved by WHO, do I still need to get the vaccine from the United States after I enter school at CSU?
Yes, you will have to. You'll have to start one that's approved in the United States and start the series over.
Someone is wondering if the AstraZeneca vaccine is a WHO approved vaccine.
It is, I believe. Yes, it is.
Great. Sorry, I'm just reading the questions here.
That's okay.
Bev, I'll throw this one to you as well. This person says, I just got my first shot of the COVID-19 vaccine. Can I receive my other vaccines, such as MMR, before the second shot of the COVID vaccine?
You can. Yeah, they used to have a 2-week wait period, but they've gotten rid of that. So you can get any vaccine anytime after you've gotten a COVID vaccine.
Okay, excellent. That answers a couple of questions, actually. Okay, and again, I just want to reiterate concern for folks who are maybe arriving in the US without any of these required vaccines. I just want to reassure you that you can make an appointment at our immunizations department and you can receive those vaccines. So I don't want you to fret too much about that deadline, because as Bev said, if you're showing in progress for these, it's okay if you are not, I think, fully compliant by that August 23rd date.
Yeah, and I think it's just the most important too, if you're not vaccinated with COVID, to be wearing a mask when you're out and about for protection.
Thank you, Bev. I appreciate you sharing that too. Okay. I'm going to switch over to some insurance related questions. And then if there's some immunization questions and if Bev, you're able to stay on, maybe I'll ping you back on.
Okay.
That's okay. Lynn, are you still on the call? Oh, maybe she's not.
Yes, I'm here.
Oh, you are. Yay. Okay, excellent. Thank you so much. Okay. I didn't know if you wanted to kind of just talk through this process with students a little bit more in depth, knowing that international students are automatically enrolled in SHIP. So this student says, if I'm using CSU insurance, do I need to do anything for this health insurance requirement?
Great question. No, you are automatically enrolled as soon as you register for classes. The charge does go to your student account. It is an insurance plan is only for students. So that was a question that I saw a number of times. On the CSU Health Network website, under the student insurance plan for international students, at the bottom of that page, I don't know if you can put that link in there, Abby, but the very bottom of that page is information for students looking for plans for spouses or dependents. They're just some options that we know are are okay options. They do not meet the student insurance requirement, so it's not something a student could take, but it is something a spouse or a dependent could take. So you should check your CSU email account. You will probably have received an email from a company called Ameriben, AMERIBEN. And Ameriben has sent you an email, or should have sent you an email, letting you know that they please go out and create a My Ameriben account, and that will provide you instructions on how to download your CSU insurance ID card. So that was another question we got a number of. The student insurance plan at the Health Network, Abby already went over this, but there is no cost for most services. So I had the question on here a few times if dental and vision was a covered benefit, and dental and vision is actually not covered under the medical, but we do have $250 that you can spend in an academic year towards dental or vision services at the health network. Most other services, including pharmacy, prescriptions, are going to be covered at 100% at the CSU Health Network. So it's the best place to start your care. And if you have something that our doctors can't take care of, they will refer you out, but you will be subject to a deductible, which is $500 for international students. And that means that that portion is your responsibility for the first $500 worth of services outside of the health network. And then you are responsible for a 20% cost share. So for example, if you went out and had a surgery and it cost $20,000 because you had a knee replacement, and this is kind of a big thing, but just as an example, you'd pay the first $500 of that $20,000, and then you would be responsible for 20% up to what we call an out-of-pocket maximum, meaning the most you could pay would be $6,850 in a plan year. Most students, I can tell you, don't ever get to that point, but that's an extreme case, and that's how you would calculate what you could potentially owe if you have services outside of the health network.
Thank you, Lynn. Going ahead and answering some other questions directly in the chat. Let's go back here and see if there's any other that Lynn would be able to answer for us. So Lynn, this person is saying they're wondering how they can obtain medical insurance. As we already talked about, international students are automatically enrolled in SHIP, but they said they have not received a social security number yet, and they are wondering if this will delay their application. And I don't know if you can speak to that, if that's required for this.
Yeah, so for our student health plan, a social security number is not required. If a student was trying to purchase health insurance outside of the student health plan, there are a lot of health insurance options out on the World Wide Web. I will just say that. But to be perfectly honest, the only place I would ever recommend somebody go to purchase insurance in Colorado would be to the Connect for Health Colorado, which is our state's website for health insurance. There are a lot of insurances that you could purchase, but many of them, if not all of them, for international students that are sold for international students do not meet our requirement, as Abby identified earlier in the presentation. So if you were to look at purchasing a plan outside of the CSU student insurance, I would encourage you to check with our office first to make sure you're not purchasing something that wouldn't be approved. I don't know the answer about social security number. I think that some plans may require that for enrollment, but I don't know the answer to that question.
That's okay. Thank you so much, Lynn. And so this other question is, when is SHIP available to use for international students? And so your fall 2021 SHIP coverage date started on August 1st. And so Lynn, is that correct that SHIP was available starting on August 1st? Okay.
August 1st through December 31st.
Great. Lynn, this student says, I am a sponsored student, but my sponsor has not yet paid for my attendance. Am I still covered by the insurance?
So if your sponsor is covering you for health insurance, you will not want to stay enrolled on our plan if your plan has been approved by the university. So I would encourage you to talk to international programs and share with them your sponsor letter and make sure that you're on the right health insurance plan before you start using services.
Great. This next student says, how are cases that may require surgeries handled under the CSU student health insurance plan?
Sure. So your plan does have coverage for surgery. The health network does not offer surgeries. So what you might do is to come in and talk to our referral coordinator or our insurance navigator, and they can help you to find a provider in the community that is a contracted Anthem Blue Cross Blue Shield provider, which is the insurance plan when you're seen outside of the health network.
Great. This next person says, and I can try and answer this, it says, I need to get a prescription for ADHD in the US. If I get diagnosed, could I get that prescribed at CSU by someone? And so we do have psychiatrists on our staff. And so I would just strongly encourage you to make an appointment with one of our providers, and then they would be able to help guide you along this and see if that is something that they would prescribe as well in the United States. So definitely call and make an appointment to access our services. This next person says, when I'm sick and it's not life-threatening, can I visit and get treated immediately at the CSU Health Network? And so the answer is yes. If you have an urgent need for medical services, you can definitely walk into our facility and be seen. Or if it's less urgent, we definitely encourage appointments. But you can, if it's not life-threatening and you're sick, you can walk in and seek care at our facility. Okay. Yes, the due date too, it says, do you have to complete the tuberculosis assessment or test before the first day of classes? And yes, that is the due date for that. Does the CSU Health Network refer students to external hospitals for further treatment? So depending upon your situation, if we are not able to provide certain services at our facility, yes, we may provide referrals if we are not able to provide you a service at our facility. So I guess the answer is yes, we can refer students outside of the health network. Okay. Lynn, this person is wondering if you could please go into more detail. It says, could you please explain more how sponsored students can waive their health insurance?
Sure.
And I can also probably give a link to that student as you are also talking.
Yeah. So international programs will take your sponsor letters. There is a list of countries where the sponsors are approved to for their health insurance plans, and international programs could guide you as to whether your country's insurance is approved, and you would need to provide proof of that letter to show them, and then they would essentially, they're coding you out in our CSU system to make sure that you're not being enrolled in or billed for the student health insurance plan. And the deadline to do that is going to be September 8th, that you'll need to get that letter in to international programs no later than.
Great. Okay. Just making sure I'm answering all the insurance questions. Okay. So this person is saying, is the insurance automatically included in my fees, or do I have to apply for it? And so while you don't have to apply for it, you will be automatically enrolled, but the cost of the insurance is not included in your student fees.
That's correct, Abby. It's a separate line item, and on your student bill, it says student health insurance.
Okay. This person says, I have not received any emails to open an Ameriben account. Who do I contact about this?
I would encourage you to, if you just registered for classes, it will take up to 7 to 10 days for that to get to you. If you have been registered for classes for quite some time, I would encourage you to call the Health Network Insurance Department at 970-491-2457 and option 1.
Okay, I will put that in the chat as well real quick.
Thank you.
You're welcome. Okay. I'm going to take an educated guess on this one. This person says, are my French prescriptions valid in the United States, or do I need to get new prescriptions? And I'm fairly confident that you will need to get new prescriptions. If Bev or Lynn, if either of you know the answer to that for certain, please feel free to chime in, but I do believe you will need to get new prescriptions.
I would agree with you.
Okay.
I think so too, but I don't know for sure. I'm gonna have to check with pharmacy.
Sure. Okay, Lynn, back to you. This says, since SHIP does not cover dental care, do we know how much a routine dental cleaning costs? I guess I can put our costs in the chat.
Yeah, we're fairly certain that a dental cleaning is a regular dental cleaning is going to be somewhere between $200 and $250 with x-rays and a cleaning. But it will also depend on the last time a student had dental care and how much care is needed. So our dentist would have to provide that information at a consult to be certain.
Okay. Yeah, okay. Looks like I'm just going to want to reiterate again, I'm getting numerous questions here in the chat about folks not receiving an email from AmeriBen. So as Lynn said, if you've just registered for classes, it will take about 7 to 10 days. So please kind of be patient there. Give it a couple days if you just registered. And then if it's been a while since you've registered and you have still to receive this email from AmeriBen, please call our student health insurance office. So I'm going to kind of answer the questions about AmeriBen Live, just for folks to know that. Sorry, there are still more questions. Hey, Bronwyn, are we on a time limit here?
This is planned for until 11:30.
Okay, great. And Lynn and Bev, if you need to drop off, let me know. We're coming down to the end of our questions anyway. But I certainly want to respect folks' time.
I need to drop off for about
Okay.
to see a patient for about 15 minutes. I might be able to come back on towards the end, so I'll let you know.
Okay, thank you so much. Okay, so I'm going to do my best to answer the remaining immunization questions. Lynn, let me make sure there are no more outstanding health insurance questions. And if there's not, you're welcome to drop off here. So let me just do 1 second here.
I see one about flex dollars, and that is 250. Yeah, that's 250 annually. So, and it's only for use at the health network.
Great, thank you. And then do you see the chat about what is AmeriBen? Do you mind explaining that one more time?
Sure. Yeah. So the student health insurance plan is an Anthem Blue Cross, which is the insurance company. At the customer service piece of the Anthem Blue Cross plan is a company called AmeriBen, and they partner together. And students would want to reach AmeriBen to get their ID card, and that's an online process. They could also reach AmeriBen to talk to them about claims for services outside of the health network. And then the other part of the plan is the health network services, where care is received at the health network, and there is no cost sharing, and it doesn't get processed through AmeriBen or Anthem. It's care outside of the health network is AmeriBen and Anthem, and care inside the health network is our student insurance office.
Great. Thank you. I'm going to again just kind of go down the questions that I can answer. Okay. I cannot, and again, I have a feeling we'll probably wrap up before Bev's able to get back on after her appointment, but the question is there any guidelines for a booster shot for Johnson & Johnson vaccinated people? I don't know. I don't even know if Bev would necessarily know. I would say we would probably be waiting on that guidance from the CDC and the FDA. And so I cannot speak to that yet. I can also not speak to, is it safe to get 2 different COVID vaccines? However, based off of what Bev is saying, if you've received 1 COVID vaccine in your country and it is not WHO approved, you will need to receive either a Pfizer, Moderna, or J&J here in the US. And so I'm just kind of reading between the lines there. I would say, yes, it is safe to get 2 different COVID vaccines, but I would definitely strongly encourage you to talk to whoever your immunizations provider is at that time, or even your doctor, just to confirm that. Because again, I am not a medical expert here. Folks are also asking, where do we access alcohol, EDU, and sexual assault prevention? So just as a reminder, those are the 2 required online modules for CSU students. And so you will be accessing those modules on RamWeb. And so you can access those on RamWeb. You should have already been receiving emails to your CSU email account. Maybe check your junk email if you haven't seen those, but they are all accessed through RamWeb. So hopefully that clears up some questions there. This question said, I've been vaccinated for most diseases, but I don't have documents. Do I need to vaccinate again? If so, can I get it done at the health network? And so we can test to see if you have immunity to those required, for those required vaccinations. And then, yes, you can receive vaccines directly at our facility. And I do want to note, for those of you who maybe have not noticed, I have put a link in the chat for information on those COVID-19 vaccine clinics that are happening at Moby Arena at CSU during move-in week. And so there's information on that link on how to register for those vaccine clinics. And so if you have not received your COVID-19 vaccine, we certainly strongly encourage you to sign up for one of those slots and receive your vaccine before the first day of classes, or your first vaccine before the first day of classes. Okay. Someone is asking us about different forms that they may have seen on the student health portal if they need to complete those. And so yes, the answer is please complete the health history, acknowledge that you've read our office policies, as well as a tuberculosis assessment. So if you're getting prompted for anything on the CSU student health portal, definitely please complete those forms. Someone is also asking if there's a quarantine protocol after arriving for international students without a COVID-19 vaccine. I cannot speak to that. I would encourage you to maybe talk to someone in international programs. They may know better than myself. But like Bev mentioned, definitely if you are not vaccinated, please wear your mask.
Abby, did you say that was a question about quarantine?
Yes, it says, is there a quarantine protocol after arrival for international students without a COVID vaccine?
Yeah, so we were told about a week and a half ago that there is not going to be a quarantine requirement. We did tell students that there was going to be. So if you got an email that said there was going to be, we tried to send a follow-up the next day. There will not be a quarantine requirement for fall as of now if you come unvaccinated. But like Abby said, do follow the requirements if you're not vaccinated and wear a mask, and there might be some other information coming soon.
Yep. Okay, this person says, I was vaccinated against COVID last May in the US. Where do I submit the certificate? So I will drop a specific link in the chat for you as well, but you will submit that online through the CSU Student Health portal. There is information that I will be dropping to you so you know exactly how to submit that as well. And I'm just going to drop that in the chat so folks can see that here. Just a moment.
Abby, there was also a question about not being able to access the site for My Ameriban, even though they had received the email. So I just put the phone number for My Ameriban in here.
That's
right
great.
above.
Thank you, Lynn. I appreciate you doing that.
Yeah, sorry, I don't know why you couldn't access the site, but Ameriban should be able to help.
So this next question is, I will be arriving at CSU at the end of August. I don't have any immunization documentation and I'm hoping to get vaccinated in the United States, which is great. Can you allow me to register for classes? So I do want to clarify, you can register for fall semester. It is a hold for spring semester that will be put on your account. And so as Bev had mentioned, as long as you're showing in progress for these vaccines, that kind of meets the requirement. So you will be able to register for fall semester. You'll be fine at spring semester. That there will be a hold. So just know, definitely, I would encourage you, if you already know that you're wanting to receive your vaccines at our facility, please call and make an appointment so that way you can get in there as soon as possible to receive those required vaccines. But just know that there will not be a hold for fall semester. It will be for spring semester. Okay. So I also want to clarify, it seems like there's maybe some confusion between this tuberculosis assessment and then tuberculosis test. So the tuberculosis assessment that is part of those kind of required health forms, it is not a tuberculosis test. So you are not getting pricked with a needle. So this is just a couple questions online that just assesses your potential exposure to TB. So we have a question that, is the assessment necessary? Yes, it is necessary. We do need to screen for your potential exposure to TB. However, this is not an actual test. So it's just a couple questions online, and you can complete that through the student health portal. Okay. We answered that one. Let's get that one. Lynn, if you're still on, I'm going to ask you to chime in on this one, please. It says, does the insurance fee have to be paid before I can be seen at the health center? I'm expecting it to be covered by my graduate school program as a graduate assistant. Lynn, are you still here?
Oh, I am. Sorry, I
Okay.
was on mute.
No, that's totally okay. Would you like me to reread the question for you?
Nope, I heard you. I heard you.
Okay.
So the charge just goes to your student account, and from the Health Network's perspective, you've been billed for the insurance and you can use services.
Great. Thank you so much.
Yeah, you're welcome.
Okay, I want to. So it says, is alcohol EDU required for graduate students? And I believe the answer is no, alcohol EDU is not required for graduate students. So the checklist for graduate students is slightly different than for undergraduate. So in the chat, I will drop the checklist in for there, but just know if you are a graduate student, alcohol EDU is not required. So let me drop these in the chat real quick. And then we'll drop the undergraduate as well.
Abby, have we put the assistantship health insurance contribution link in it yet?
No, we have not. Would you mind doing that for me, please?
Yep, I'm doing that now.
Thank you.
So that is, oh, I should have titled it, but that is the students that have an assistantship as a graduate student. It's information about how the graduate school handles that health insurance contribution.
Great. Thank you. Okay.
Sure.
All right. I think we're getting close here, everyone. Someone says, do I need to do my TB test before receiving the meningococcal vaccine? And the answer is no, you do not. Let me. So this person says, I have AstraZeneca and my record was approved on the Health Network portal. Do I still need to get another vaccine in the US? As Bev had mentioned, we believe AstraZeneca is one of the WHO approved vaccines. And so if your vaccine was approved on the Health Network portal, then no, you should not be needing to get another vaccine in the United States. And then this is a wonderful question. So may I get a COVID test on campus and is it free? So we are, I believe, offered COVID testing as well as COVID screening. And again, I do want to note that the COVID vaccines are free, so you can definitely get those. And I'm going to be dropping in the chat our main COVID-19 page for the university. And there's information here about our COVID-19 symptom reporter, our vaccines, information for students. So all sorts of information, and definitely it's a wealth of resources for students. So let me drop that in and you can read more about that. Okay. So the next question is, can I make an appointment for my MMR and my TB test for the same day? That would be a question for our immunizations department, but I'm sure if they're able to schedule you for both on the same day, they would probably be happy to do that. But again, please call our immunizations department and they can help you with that. Okay. All right. Bronwyn, I don't know if you can answer this one. I think this might be covered in the quarantine question, but this says, when we reach CSU, do we have to show anything other than negative PCR test?
That negative test is only going to be required to get onto the plane. And there shouldn't be anything else that you'll have to do.
Okay.
And that isn't needed to get onto campus either, just for the entry requirements to get onto the plane.
Okay. I think I've answered all of the questions that I am able to answer with the knowledge that I have. Lynn, you're welcome to go through the chat there. You're welcome to go through the chat, see if there's anything you can answer. Otherwise, I think we're pretty much good to go.
The only other one, I think, if your vaccine card is not in English, it needs to be. I don't know what Immunizations does with that, but I'm pretty sure they have said they can't accept the cards without them being in English.
Yes, I agree. And if this, whoever submitted this, I would maybe encourage you to reach out to our immunizations department, and they can potentially put you in touch with someone who does translation, or maybe someone at international programs can help. Those are just kind of some guesses there. Thank you for chiming in on that, Lynn. Okay. And again, for someone who's asking if the COVID shield is approved by the Health Network, I can't speak to that. If it's a WHO approved vaccine, it should be approved by the Health Network. So you can go online and look at who the World Health Organization approved vaccines are, and you can find your answer there. Oh, okay. I would like to forward my dental x-ray records to CSU for an appointment. How do I do this? I will drop a link directly to you on medical records. This, I would say, is your last chance for folks to submit questions using the Q&A function, because we are wrapping up here. So if you have any other questions, please feel free to submit them. Doesn't look like any are coming through. Okay. All right, I think we've gone through what we could get through. So if there are no other questions, thank you so much, everyone, for attending the presentation from the Health Network. I know it is a lot of information, a lot of important information, and I appreciate you paying attention, all the wonderful questions that were asked. And special thank you to Lynn and Bev. I appreciate your time here coming and answering questions and further clarifying things in the presentation. It obviously is a lot to cover, so I really appreciate your time here today. And again, Bronwyn, if folks have questions after this presentation, please feel free to email me, and we're happy to try and answer them, or at least put them in touch with someone who can.
Great, thank you so much.
Yes. Okay, and I do believe this session has been recorded, so Bronwyn can speak to if you'll have access to that or not afterwards.
Yep, it will be, it has been recorded, and within a few days we'll post it on the orientation page where the schedule is and where the Zoom link was. So you'll be able to access it there within a few days.
Awesome. And thanks so much for bearing with me with our little audio snafu. And I just wish you the best of luck during the remainder of your summer and kind of in coming to CSU, and best of luck during your fall semester as well. So thank you so much, everyone, for your time.
Thank you.